Welcome to Rec Sports. Safety is the #1 priority in all of our programs and facilities, both for our participants and you. As a team member, you have the responsibility to maintain a safe environment as well as assist anyone in need of care. During this training component, we will cover bloodborne pathogen protocols and some situations that may occur while you are on the job. Join us as we present our bloodborne pathogen training. After completing this training, you will be able to recognize how diseases occur and spread, ways pathogens enter the body, and methods to prevent exposure. You will be able to identify personal protective equipment, also referred to as PPE, emergency responses to exposure, waste management practices, and the University of Florida Exposure Control Plan. The Occupational Safety and Health Administration, or OSHA, issued the Occupational Exposure to Bloodborne Pathogens Standard to protect employees by removing or reducing the bloodborne pathogens hazards from the workplace. This standard applies to employers who have employees who, through their job duties, may be exposed to bloodborne pathogens. An important part of bloodborne pathogen training is minimizing disease transmission. You will be less likely to contract an infectious disease if you are informed about their risks and how they are transmitted. By using proper workplace practices, personal protective equipment, and receiving annual training, OSHA believes that disease transmission can be minimized and save lives. For any infectious disease to spread, all 4 of the following must be met. A pathogen has to be present. There is sufficient quantity of the pathogen to cause disease. A person has to be susceptible to the pathogen. The pathogen enters the body through the correct entry site, such as broken skin or mucous membranes of the eyes, nose, and mouth. The most common forms of pathogens are bacteria and viruses. Bacteria can live outside of the body and do not depend on other organisms for life. Strep throat and tetanus are examples of bacteria that can cause disease once inside the body. If caught at an early stage, bacterial infections can be easily treated with antibiotics. Viruses cannot live or reproduce without a host. Infections caused by viruses can be difficult to treat without medication. Prevention is critical. There are several ways pathogens can enter the body. Direct contact occurs when blood or body fluid from an infected person enters another person at a correct entry site. For example, blood splashed in another person's eye. Indirect contact occurs when an object containing infected blood or body fluid is touched and the blood or body fluid enters another person at a correct entry site. For example, picking up blood-soaked materials with a cut on the hand. Airborne transmission occurs when infected droplets are spread through the air in a cough or sneeze and inhaled by another person. Vector-borne transmission occurs when a disease is spread by a skin puncture from an infectious source such as a mosquito. Once pathogens, such as bacteria or viruses, enter the bloodstream, they are considered bloodborne pathogens. Bloodborne pathogens that are highly infectious and of great concern are as follows: the hepatitis B virus, commonly called HBV, the hepatitis C virus, and the human immunodeficiency virus, also known as HIV. Hepatitis B is spread through direct and indirect contact with blood or other body fluids that may contain the hepatitis B virus. Being infected with the hepatitis B virus may cause flu-like symptoms such as fatigue, abdominal pain, nausea, vomiting, and loss of appetite. Later stages include jaundice and liver swelling and irritation. Hepatitis C is spread through direct and indirect contact with blood or other body fluids that contain the hepatitis C virus. Infection from the hepatitis C virus causes symptoms similar to hepatitis B. There is no vaccine against hepatitis C. The human immunodeficiency virus, also known as HIV, is spread through direct contact with infected blood and body fluids. Infection with HIV gradually destroys the immune system. This makes it hard for the body to fight infections and disease. HIV is the virus that causes acquired immunodeficiency syndrome, also known as AIDS. OSHA requires employers to have an exposure control plan. The University of Florida Bloodborne Pathogen Program Exposure Control Plan is a written program outlining protective measures that UF will take to eliminate or minimize employee exposure incidences. Rec Sports is a participant in the UF Exposure Control Plan. The Exposure Control Plan describes universal precautions, personal protective equipment, commonly known as PPE, engineering and work practice controls, and housekeeping. The concept of universal precautions is to treat all human blood and certain body fluids as if known to be infectious for HBV, HIV, and other bloodborne pathogens. Practice universal precautions to prevent employee exposure to blood and other potentially infectious materials. It is important to protect yourself from disease transmission. Personal protective equipment can be found in the following central locations throughout our facilities: facility control desks, strength and conditioning room desks, equipment room, lifeguard rooms, and boathouses, to name a few. Using PPE will help keep you and your coworkers protected from disease transmission. Personal protective equipment provided by Rec Sports include gloves, mouth and face shields, safety glasses, aprons, pocket masks, and barrier devices. Rec Sports provides non-latex disposable gloves in a variety of sizes to our team members. Always wear gloves when providing care to injured or ill people. Remove gloves properly to prevent coming into contact with blood or other body fluids. Let us demonstrate. Pinch glove at the wrist, being careful to touch only the glove's outside surface. Pull the glove inside out toward the fingertips without completely removing the glove. Next, with a partially gloved hand, pinch the outside surface of the second glove. Pull the second glove toward the fingertips until it is inside out, and then remove it completely. Finish by grasping both gloves with your free hand, touching only the clean interior surfaces of the partially removed glove. With your free hand, pull the glove off completely. After removing both gloves, discard in an appropriate container. Wash hands thoroughly using soap and warm running water. Rub vigorously for at least 15 seconds, covering all surfaces of the hands and fingers. Rinse hand with water and dry with a paper towel. Engineering and work practice controls are procedures implemented by the employer to help reduce the risk of an exposure event. These controls include providing and using personal protective equipment, cleaning and disinfecting materials, biohazard disposal materials, and hand sanitizers where hand washing facilities are not available. After providing care, always clean and disinfect the surfaces and equipment that were used or soiled. Wear disposable gloves and personal protective equipment. Clean up spills immediately or as soon as possible after the spill occurs. The following video will demonstrate correct cleaning protocols. To clean up a large spill, sprinkle Red Z fluid control solidifier evenly over the spill. Allow sufficient time for solidification to occur. Remove solidified material with plastic scoop provided in the biohazard cleanup kit. Spray with dispatch, thoroughly wetting the area. Let stand at least 10 minutes. Use absorbent material to wipe up the dispatch solution and dispose of the material in a biohazard bag. To clean up a small spill, wipe up small spills with absorbent material. Place all soiled materials in a biohazard bag. Clean and disinfect all equipment and work surfaces with dispatch wipes or Sani-Cloth Plus wipes, keeping the area thoroughly wet for a full 5 minutes. Let air dry. When the area is clean and disinfected, remove and dispose of gloves and other protective clothing in a biohazard bag. Wash hands thoroughly with soap and warm water for at least 15 seconds immediately after cleanup. In the event you are exposed to or think you may have been exposed to a bloodborne pathogen, follow these steps. Immediately call the Needle Stick hotline at 866-477-6824 and follow their directions. Wash the exposed affected area for approximately 15 minutes as soon as possible. Notify your supervisor and write down what happened. You and your supervisor will notify the Workers' Compensation Office at 352-392-4940 during regular business hours or first thing on the next business day to complete a first report of injury or illness form. Complete a Rec Sports injury report form for yourself. Notify the Safety Risk Manager at 352-273-2404 and forward copies of all forms to room 106S in the Southwest Recreation Center. To review, take every precaution to prevent disease transmission. Use personal protective equipment. Wash your hands frequently and every time after providing care. Dispose of all biohazard materials in an approved container. By following the procedures in this bloodborne pathogen training, you will be prepared to perform in any situation that may occur during your shift. You are now ready to take the bloodborne pathogen training quiz. Please complete this quiz to signify your participation in this course.